initially apply light pressure, and the wrist should be slightly flexed, maybe about 30 degrees, so that you open up the wrist joint. And then you press slightly, initially just applying a pressure, because remember, you're not sure if there's any inflammation of the joint, so you don't want to, of course, scare off the patient. And remember, if the patient says, ah, you fail, right? Or at least you feel the section that says rapport with the patient. Yes, you will. All right, so you apply pressure and then you go outwards. What you're feeling for is, and of course you're always watching the patient to see if there's any grimacing or any discomfort. So you're feeling the joint line to see if there's any synovial hypertrophy, and of course you're watching the patient to see if there's any pain or discomfort. And of course you're also feeling to see if there's any warmth of the joint, and so on, okay? And then of course you bring the patient, at the end of that, after you palpate the entire joint, you want to see if the patient has full range of movement of the joint, okay? So we bring the patient through full range of motion, flexion and extension, okay? All right, so that's for the wrist. Now, in terms of the metacarpophalangeal joints, start with the first MCP joint, and we evaluate them with the thumb and the index finger. And again, we're feeling the same thing. Now, when it comes to the others, it's a little bit tricky. So we evaluate like this. So with the both thumbs. Then the IP joint, first IP joint, evaluates laterally and from above. You're trying to feel the joint line, and you're also trying to feel laterally to see if there's any synovial hypertrophy, and also to feel if there's any joint effusion, and of course to elicit any tenderness. And you continue. Now, especially when you palpate from above here, you get a feel for whether or not you can determine if the patient has any synovial hypertrophy. Right? Well, he doesn't. All right. So that's basically what you do. All right. So you do that for all the joints really quickly. And then, so all right, so we've done the inspection, we've done the palpation, we turn over on the hand, we do a quick inspection. Now we're doing a quick palpation here, and we're just feeling to see if there's any vena or any wasting, and then we just look quickly to see if there's any nicotine staining or any vascular infarcts or Raynaud's, and then we check the extensor surfaces, and everything is fine. You do that on both sides, and then the last thing that we're going to do is just to test his grip strength. Now the grip strength, it assesses everything. It assesses power of the interossei, power at the level of the MCP, and at the PIP joint, everything. So once you've done the grip strength, so you just ask him to make a fist around my fingers, and squeeze as tightly as you can, don't let go, and that's it.